Hello friends, I am Dr. Dhruv Zutshi. I am a senior consultant neurologist. Today I'll be talking in brief about epilepsy or seizures, or like we call it as mirgi in Hindi, which is the common term which people understand. So what is a seizure? There are three types of seizures. The most common type of seizure is a lot of us have seen either some relative have it, somebody in the locality have it, or sometimes we've seen on television wherein the patient is shaking violently and the eyes are uprolling. So that is one of the most common type of seizures called as generalized tonic-clonic seizures. Then there are two other common types of seizures, but people do not realize that it is actually a seizure. So one of them is called as a complex partial seizure. In a complex partial seizure, there is no involuntary movement of the limbs. There is no violent movement. The patient just loses touch with the surroundings. So for example, if you are talking to the patient suddenly becomes a little unresponsive, starts looking here, there, a little aimlessly, sometimes may have some simple hand movements, some oral movements like moving the lips, moving the jaw. And this may last for a very small period of time, like 1 to 2 minutes, sometimes only a few seconds, following which the patient comes back to their consciousness. And suddenly you feel that he was lost for a while. So this is called as a complex partial seizure. Now these are seizures which are very commonly missed by people. Then there are seizures occurring in small children called as Abson seizures. These are seizures wherein you just see the child starting to blink this way, and within seconds the seizure goes away. So nobody realizes what the child is doing, but suddenly the child feels disconnected from whatever conversation or whatever was happening. Quite often the teachers say from school start complaining that the child does not concentrate in school. He keeps, he looks disturbed. He's not able to follow what we are teaching or writing on the blackboard. So that is when you start wondering what is happening to the child. The child seems absolutely normal otherwise. So these children could be having these small absence seizures, and they can occur multiple times in a day, like even 30, 40, sometimes even 100 times in a day, lasting for 5 to 15 seconds. And it just leads to an interruption in the flow, and then the child becomes absolutely normal. There is no loss of consciousness, there is no abnormal movement. You feel that the child was just the way he was. So these are the three common types of seizures. Now, how do you treat these epilepsies? Now, epilepsies can be idiopathic in nature or they can be symptomatic. What do I mean by this? By idiopathic, I mean that the MRI is absolutely normal, and just the EEG it's like a electrical study of the brain when different electrodes are put on the brain shows some abnormalities. So that is called as idiopathic epilepsy. Then you have something like symptomatic epilepsy. Symptomatic epilepsy means that the MRI is starting to show some abnormalities, which could be like some part of the brain could be a little degenerated or a little thinned out. There could be a history of injury to the head leading to some scarring of the brain, which can be there. Then there can be some infection in the brain or some granulomas or some small lesions in the brain. And then rarely there can be tumors or clots in the brain. So these are called as symptomatic epilepsies. Why it is important to understand the difference between them is that they require a different set of medicines, require different treatment so as to stop the epilepsy from occurring. In idiopathic epilepsies, where the MRIs are normal, just medicines for a long period of time takes care of the epilepsy, and generally these patients respond quite well to treatment. In symptomatic epilepsies, you also have to treat the underlying cause of the epilepsy or the seizure. So that could be actually treating a different disease along with treating of the seizure. And that may sometimes be difficult to manage, sometimes may behave aggressively as well, because if the disease does not respond adequately to treatment, the seizures also become very difficult to manage. Hence, it is very important to understand what kind of seizures are happening to a person, and then accordingly decide what needs to be investigated and how we should go about the treatment. Thank you.